You like
Hello, everybody. Greetings from Confederation of Medical Association of Asia and Oceania. I'm Dr. K.K. Agarwal. We present to you 56th non-stop meeting. With me, I have my immediate past president, Dr. Ravi Naidu. Dr. Akhtar Hussain is also here. Others will also join. Dr. Akhtar, can you open yours so that we can bring you? We have Akhtar is also here. So we would like, because there are a large number of people who want to listen to our discussion, so we will be focusing spotlight on the CIMAO members. And today's discussion is we want to listen from all of you, then to present our data. The reason being the number of cases in India are sky rising, and its effect will be seen. It affects will be Dr. Sajjad has come. Its effect, Dr. Nidhi, its effect will be seen in the neighboring countries in the next 3 months. So take it for granted that whatever is happening today, we are likely to see the effect of this in the neighboring countries in the next couple of months. We have seen a wave in India after 3 months of Europe, and after 3 months of Indian wave, it may change from one place to another. So we would like to know, as an association, as a joint association at CIMAO, what can be done? What might be the reason? I'll tell you what is happening in India. In India, we are having the UK strain predominantly in North India, in Punjab, in Delhi, we are having the UK strain. And then we are having a special Indian strain in Maharashtra, which we are calling it as a double mutation, which is 617 strain, which is 617 strain. Saurabh, you have to make the Pakistan and Bangladesh into in. They are in, but they are not spotlighted. Saurabh,
I'm doing it the camera. I've just requested for the camera.
okay. They should be able to come even without camera. They should be able to come even without camera. So what we are seeing is a special strain we are seeing in India that is called as a double mutation, which is 484 and 452 mutation, which is being seen in India 484, 452 mutation. And then we are seeing another mutation which is coming in western part of India, which we call them as triple mutation, which is 501, which is 614, and which is also having a deletion in NTD, which is having a deletion in NTD. So we are at this moment in multiple waves of cases are coming in India. The same effect, we are likely to see them in other neighboring countries in a period to come. Our mortality, I can tell you observations in India. We are not getting the correct data. The observations are we are getting one pattern of a disease, which is showing more effect in the children. Probably that's the UK edition. We are getting number of people who are developing oxygen requirement on day 2 or day 3, which we haven't seen in the first wave. In the first wave, normal oxygen requirement will come on day 5 or day 6 or day 7. The third group we are seeing is large number of patients developing oxygen requirement after day 5. Suddenly they deteriorate, which I call them as thromboinflammation. And then we are seeing a spurt of cases developing COVID after vaccination. They are developing COVID after vaccination. And there also we are getting two groups. First group, which is much more in number within the first week of vaccination. They are becoming positive within the first week of vaccination. And then we are getting another subgroup in India, which I call them as adult systemic inflammation. Adult systemic inflammation, very high fever, very high CRP, lungs not involved. These are the patterns we are seeing. We would like to know what are the patterns running in various countries. Dr. Chaudhary. So what I will do is I will open for everybody the number of cases occurring in that particular country, and then you can start discussing. So I will discuss Bangladesh. I will discuss. Go ahead. In the meantime, I'll place word meter of Bangladesh.
Good morning, everybody. Dr. Kagarwal, actually, I joined early, so I want to just know the salient features which you have already discussed or you have already mentioned.
Go ahead.
Just you have started only?
We have just started.
So actually in Bangladesh, actually several type of variants have been observed. And here we have seen this UK variant and the South African variant also seen actually. So we observed that there was a huge surge actually starting from the last 2 weeks actually. Now it's declining. We are in lockdown situation now. So it has become half almost from there now. So going around and regarding the variants, actually, this was actually severe in and in one case at least I was reported that the patient was not having any sort of fever or cough. He was 85 years of age, and he was feeling weakness. So his son is a doctor, and he has done the electrolytes, and there was hypokalemia, and he gave this potassium to him, and he was okay for 2 days. Again, he got this weakness, so they went for testing, and it was COVID positive. So unfortunately, the patient ultimately died. Actually, day before we started, the patient died. So this is the actual feature. Actually, we are not observing much, but sometimes it's reported that patients are just presenting with a very unusual way, and so this is actually is a fear, cause of fear here. So we are just advising our patients so that any sort of unusual features they are observing, they should go for COVID testing, because we do not know actually usual features. We know that fever and cough, but it's not like that. Even the fever and cough is not there, but lung involvement is showing, and that is also a cause of this. So we have to go for CT scan early, and so that we can take the measure. So
I agree with you at this moment. Every irrelevant symptom is COVID positive and nothing more than that. At this moment, anything which you cannot explain, it is COVID.
Yeah, that is why I'm telling you. That the doctor actually is missed. His father was having COVID positive, so he has not checked his also partial pressure of oxygen. Also, he has not checked. So that was mistake. When he got it, he has seen that he was having a deficiency in oxygen supply. So they rushed to the hospital. But anyhow, some days he survived and died. Something like that.
Agree, but I want to show you here in Bangladesh, you can see a rapid rise in cases occurring in Bangladesh. Do you feel that this rise is now started reducing?
Yeah. Now it is declined. Actually, it has become half. Actually, previously it was.
So how long this wave lasted? It started from February to April. So the wave started in, I can say, 1st of March. So this wave lasted for 1.5 months.
Yeah, yesterday it was near about 3,500, something like that. So it is reduced. Actually, it's not reducing. So the one thing is maybe due to the lockdown, situation, the people may not go for the testing early. Maybe the cause also.
I know, then that will be common for all the waves. That will be common for all the waves. Can I have the Pakistan picture to understand? So in Bangladesh, we have seen a third wave, which is declining in 1.5 months. So let me take the Pakistan picture. I saw Sajjad here.
Yes, thank you very much, Mr. President. Just similar to Bangladesh, we have been observing from a couple of months that the number of cases is increasing day by day. And from the last 2 weeks, it's very much increasing, and the number of deaths is also increasing. The people are not following the SOPs, and the gathering, the religious gathering, and everything is going on, and nobody is following. So the vaccination is also a problem. The vaccination process is also very slow because that the commitment which is being made by the COVAX for Pakistan is not fulfilled. So there is a shortage of vaccine in Pakistan. But it's still going on, but with the slow process. So the situation is not good in Pakistan. It's a very alarming. But today also, the 157 deaths and more than 600 cases is registered. But I'm worried. The association is worried about the future because it's same situation is going on as the other countries, like in your countries. In your country, the number of cases gradually increased, and now in India, as you have said, and we are also observing through media that the situation is not good in India. So we are just talking to the government to just do the just implement the SOPs and fast the vaccination process so that the increased number of cases should be controlled. Otherwise, it will be a disaster in Pakistan also in future.
One thing, let me observe
Dr.
here.
Sajjad, can I just
Just
Yeah.
1 second.
Yes,
Just
Jamal.
1 second. I want to compare Bangladesh and Pakistan.
Yes.
In Bangladesh, the wave lasted for 1.5 months, and in Pakistan, it is still continuing. So these are two variations I just wanted to observe. That in Pakistan and Bangladesh, so Bangladesh will, if I say compare it with India, then Pakistan should behave more like Punjab, and Bangladesh should behave more like West Bengal, and we have two different variants of viruses there. Can we find out from our respective countries that is Pakistan having more of UK strain and Bangladesh having more of triple mutation? Because the population, the cases will go accordingly. That's my interest today. Can we find out that maybe that Pakistan and Bangladesh are behaving differently in the pattern of disease? Yes, go ahead.
Yeah, okay. Can I say we have a report of researchers in Pakistan, the Infectious Disease Society of Pakistan. They find out that we have in Pakistan three variants: the UK, South African, as well as the Brazilian strain. The variants, rather, you can say. The whole Pakistan is not yet. You are absolutely right. Punjab province is involved. Better, but now the cases in province. Hello.
Dr. Sajjad, about the vaccination, can I just ask you one thing? Because you are getting the supply from China.
Yeah. Go ahead.
Yeah, Dr. K. Carol, can I just ask?
Yeah, we have a vaccine from.
No.
Yeah, we have a vaccine in the beginning from the China. Still, we have the other vaccine with the name of Sinocan, which is in Pakistan in 18,000 volunteers. But in the beginning, we have Sinopharm vaccine from China, and which is being still going on. The Sinopharm vaccine is using in Pakistan, and but we have also the Sanocan and Sputnik through a private agency. The people are also buying and just get vaccinated through the Russian vaccine Sputnik. So we have 2-3 variety of vaccines.
Now, my question is actually, recently we have just observed that India has paused the export of vaccine, actually, which we were supposed to get by this time. But we have already talked to China and Russia, like you. But I want to be sure that whether the China's supply and the Russian supply is constant or not, so that Bangladesh also should worry about that or not.
Actually, you are absolutely right. In the beginning, the India was supposed to supply the AstraZeneca vaccine to Pakistan through COVAX, but unfortunately, the situation is not good in India. So that's why that vaccine is not reach in Pakistan. But the China, I have just heard that China is offering. I just saw somewhere in the newspaper that China is offering India and Bangladesh to help them out in vaccine, providing the vaccine. I don't know the detail of that, but they have supplied to Pakistan in a limited number, which is going on in Pakistan in very slow process, slow movement, rather, I can say.
Okay.
So what my purpose of meeting today is, my purpose of meeting today is slightly different. And I want to listen to Akhtar, Angelique, and other people. I want to listen. I want to show you one thing. And then I want to understand that. So I am going to cover up. There is a South African variant, and we have seen it settling down. So the second peak is the South African variant. So this peak has settled down over a period of time. So this peak has settled down ultimately. So this is a South African variant. So that peak, if I see, it lasted for November to March. So this took almost like, it occurred as a peak in 1.5 months. So if I say it started in November, mid-November and mid-January, so it lasted for, it took each time it took 2 months in South Africa, if it is a South African strain. Then I like take Brazil. In Brazil, we are now finding it that it is bizarre shape. It is not settling down at all. The new strain is not settling down at all. Let's take another strain in UK, which is there in all over the world. And this also we see it. Now, should I take it as a continuum of one strain, or should I take it this as the UK strain? So from November to January, 1.5 months it peaked. So from November to January, November, December, January. So 1.5 months it peaked. So most of the waves are peaking in 1.5 months. Now let's take in Bangladesh, again it peaked in 1.5 months. So do I take, then why in India, 1.5 months are over and it's not peaking? That's my question. We are in India, 1.5 months is over and it's not peaking. Are we missing something?
Is it related with the gatherings and other elections and going on?
Cannot happen because of that. It has to be a new virus. The situation will be the same everywhere. COVID appropriate behavior is not there even in UK. In UK, so let me put down the Indian graph. Let me put down the graph in India. I'm only trying to find out it because these examples you will have to see it in your own country later on. So let me see in India. We have started from 16th March. So okay, so maybe 11th of March. So that means we are seeing, this may be the reason that we are still not peaking together. So is it we are at the verge of peaking or we have a different situation? That's my question. So are we at the verge of peaking in India, or this India is behaving differently? Because if India is behaving differently, all of us are in trouble. Try to understand why I am building up these situations. So I am building up these situations that let me explain to you my concern. My concern is, which nobody is talking. So we have a virus, we have S1, we have S2. So we have a mutation occurring in UK. So there is a mutation which is occurring in UK at this 681. At this is 69, 70, and 144 deletion. And it had a mutation here called 501. This is the UK edition. Okay, so it has captured three things. It had captured a bifurcation, 541 and 6970. Then we have a mutation of South Africa. We have a mutation of South Africa. Predominantly, this is two mutations in RBM. And then we have mutations in Brazil, which are again nearing this area, which is again RBM. Okay, so these two becomes matter of concern. Okay, and then India came here 684 and 642, which is behaving like Brazil and which is behaving like South Africa. This is 617 mutation. But now we are seeing a 618 mutation, which has 60614, which has this mutation, 618 mutation, and which has two deletions, 144 and 140, 145 and 146. So I'm concerned about this mutation, 618 mutations, because what is going to happen is, pure world ko, who is going to win the world? Is it the UK strain? Is it the South African strain? Is it the Brazil strain? It is the Indian 1 strain in Indian 2 strain. Whosoever is going to win the world. So we have to be bothered about these two strains. The two new Indian strains I am bothered about. So therefore, I am warning the neighboring countries that specifically Bangladesh site that 618 may trouble us, 618 may trouble us, and internationally 617 may trouble, because maximum transit from India to other countries is from Bombay. So 617 may trouble internationally, and 618 may trouble near the West Bengal. That's what I'm talking about. I'm only talking about is, and then why, so are we seeing a wave lasting for 1.5 month peak, then 1.5 months. So it is a 3 months wave with 1.5 month peak. And if that's so, so let's go back to India again. Bangladesh, which we go back to India again. So India again, then it is causing This is today is 20th, 24th of April. And then it all started in 23 cases, 23,000 cases were the minimum. That was on 12th of March. 12th of March. So is this going to be the end, or it is still going to continue? That's what I wanted. Somebody wants to make a comment on that.
Yeah, Dr. Kakar, what about the West Bengal situation? Is it having the double mutation like that?
You know, there are elections going on in West Bengal. And you know, there are two political parties at stake. So therefore, number of testing there is not reliable. So there, the disease pattern, we are not getting the correct information. I feel there is a huge number of patients. There is a big cases in West Bengal, which is not coming out.
So India is not observing the lockdown.
India has given it to the states. No, it is not India. It is the United States of India. There are every state behaving differently. So they have given the powers for the states to lock down. Delhi is in lockdown.
Many countries have banned those coming in from India at the moment. One of them, I think, is Malaysia. They do not allow anyone from India to come in.
In Hong Kong, see, I'll tell you what is the picture in India. Do we have Dr. Chong or Dr. Chan joining or not yet? Dr. Elvin has joined. Take him in. Dr. Chan, Elvin has joined. Take him in. So what is happening is that a flight took off from India to Hong Kong. It was a 188-seater flight. We don't know how many people were there. And there was a media report, 49 landed positive. That is the amount of disease which is occurring in India. So at this moment, we have acute shortage of oxygen. Yesterday, the Delhi has a capacity to handle 250 deaths, and yesterday number of deaths were 500. Many of the crematoriums has been shut because there is no vacancy. Because once you keep the body in the crematorium, it requires 12 hours of burning and taking the ashes away. So yesterday, in many crematoriums, they said full house, no more bookings. That's the state which is occurring. So I still feel, last time what we discussed, I still feel in a situation like this, 1 milligram of prednisolone per kg body weight, along with a blood thinner, timely blood thinner, can help these people. This is what we passed last time, that in a patient of crisis, when nothing is available, you don't know what the situation is. You don't know. See, the waiting list in Delhi today for a C-reactive protein is 72 hours to collect the sample. You have to book 72 hours to collect the sample. RT-PCR report is not coming before 72 hours. So there's so much load. In that particular situation, we have to do a crisis management. And the crisis management is prednisolone 1 milligram per kg body weight or equivalent dose, along with a therapeutic dose of blood thinner, which can be warfarin, which can be acetrom, which can be dabigatran, which can be rivaroxaban, which can be apixaban. If you give them till the bed is available. There was a time in India, 2 days back, the 25 people in a hospital died because oxygen was not available. And then there was a picture where all the hospitals shifted from high flow to low flow oxygen, which we know is not going to make a difference. And then yesterday instructions have come by the government officially that keep the oxygen at 94. That means You don't need to bring the oxygen level to 96, 97 in serious patients. So now the yesterday's clear-cut instructions by the government is that don't use oxygen if it is not needed and maintain the oxygen levels at 94. So these crises are occurring. This can happen in neighboring countries. This can happen in CMAO countries. So let's learn lessons from each other.
Dr. K. Agarwal,
Yes.
just do you refer to this actually Sardas will say because of these mutations or something else actually?
Because of?
Because of this not observing the protocols.
I don't agree. I don't agree. I don't agree that protocols have anything to do with the rise. It's a new mutation. It's a new mutation. See, our post-vaccination infection rate is very high. And then we are getting, so therefore it cannot be only not observing precautions. It cannot be. It is a reason, but it cannot be the only reason. It's a new mutation where the incubation period is shorter and the viral load is very high.
What
But
about the-
Mr.
No,
Mr.
what about the- Dr. Sajja, just a moment. What of the presentation? Because we are worried actually what you said. We are also discussing here whether the Indian variants very. So we are just worried about and is it difference in the presentation? Is there any difference?
We are getting, I told you initially that we are getting various types of presentations. One of the presentation we are getting is that we are getting early pneumonia. That means day 1, day 2 pneumonia. We are getting happy hypoxia cases have increased compared to the first wave. Compared to the first wave, we have large number of cases coming with oxygen requirement. Rest all are manageable. The one which are causing mortality and the one which are a concern is people coming with oxygen requirement. There are two patterns who are coming, one requiring oxygen requirement early, and the second one requiring early oxygen requirement on day 8 to day 14. So the day 8 to 8:14, we know it's a delayed treatment because that's thromboinflammation getting precipitated on day 4. But that patients presenting with rapidly progressive thromboinflammation on day 2, day 3, day 4 is a new observation. Can we listen to South Africa or Brazil? South Africa.
Good morning, Dr. KK Agrawal and the colleague. In South Africa, numbers are going down. As you know, it was 22,000, 25,000 2 months ago. Now, average is 900 to 1,400 every day. And some provinces, they are 10 or 5. And number of testing also decreased at the moment. Death rate is also gone down. It is within the region of 10 to 20 a day. And SOP is going down. People are now very much relaxed and not wearing enough mask in the marketplace and shopping center. And the vaccination total by JJ Johnson & Johnson is given 340,000 to the health worker. We haven't received report post-vaccine COVID-19 so far, but there are some health workers after 2 months went and do the antibody titer. And some of them didn't develop any antibody post-vaccine, especially Johnson & Johnson. We're only getting Johnson & Johnson. And Pfizer is promised to be coming anytime, 2 weeks' time. So this is the situation in South Africa.
See, my discussion is slightly different. And my discussion is this. My discussion is this. What is the difference? If you can see here, in India, we have seen a very rapid rise of cases compared to South Africa. The rapidity of wave is different. South Africa is different, and this is different. Now let's see in Brazil. Let's see in Brazil. Let me again compare Brazil with India.
Sleeping.
Compare Brazil with India. See, the same pattern we are likely to see. So see, the Brazil pattern and Indian patterns are different. Then I will take the UK pattern. Then let me say the UK pattern. This is the UK pattern. And this is the Indian pattern. Indian pattern is not matching. So are we heading for a, no, this is, sorry, the Indian pattern. So if I see the Indian pattern and the UK, these are the main variant of viruses. So for what I'm trying to say is, these are the three viruses in the world. South African, Indian response is different. Brazil, Indian virus is different. UK, the Indian virus is different. The response of the Indian virus is different. So are we heading for the fourth variant of concern? That's all. My discussion today is that we are all the time concentrating on South African, Brazil, and the UK variant. Is the Indian variant different? If it is, then we have four variants of concern in the world. So we have to be careful about that. So I'm only comparing these three examples: South Africa versus India. That's a strain. The virus is different. Brazil is different. UK is different. Rest all will behave like either of one of them, because they don't have a strain of their own. So I will only pick it up from California. Let me see California strain, if I can pick it up. So let me see California, if I can pick it up. California is not there. So they have only the country. So I will try to pick it up from California strain. So if I say California, if I say the California state, if it is different. So California is also different. So I can't say that California, so we are behaving differently. That's what I'm trying to say. Let's try, that's the only thing I'm trying to say is, nobody has talked about it the way I am talking. Our wave is different than that of California. So if we are this, then we are for a problem in future. This new wave in India is going to create another pandemic because we are different. So this California strain is different. So these are the variants of concern: the UK, South African strain, Brazil strain, UK strain, and California strain. That's what I'm trying to say. I have no answer. I'm only giving you the observations. I'm giving South Africa versus India. India is not behaving like South Africa. India versus Brazil. India is not behaving like a Brazilian wave. India versus UK. India is not behaving like the rise is too steep. It's not behaving like a UK strain. California, India is not behaving like a California strain. That's all. So therefore, Indian strain is a different strain, whether it is which one, 617, 618. So neighboring countries have now 4 risks, including the Indian strain, 617 and 618. So all these 4 countries, South Africa, Brazil, UK, and California, must work together. 5 countries must work together to find out in which situations the virus is becoming heavier on us. Over to Hong Kong. Let's see the Hong Kong response. Today we don't have the, is there anybody, Dr. Alvin? So this is the Hong Kong response we are getting. This is the response we are getting from Hong Kong, which is settling down. Number of cases have never been so high. Then let's see the response from Singapore. Let's see the response from Singapore. Hey, there are no cases in Singapore at all. Let's see the responses in South Korea. So let's see the cases in Singapore. Let's see South Africa, South Korea,
What about Malaysia?
Malaysia. I'll pick it up. South Korea is showing cases. Let's pick up Malaysia. Let's pick up the cases in Malaysia. Malaysia is also now started rising in the cases. So I expect Malaysia to be in trouble because the number of cases are rising. So Thailand, let's see the Thailand. Thailand is also now started showing number of cases are peaking, increasing, and increasing. Let's see Nepal. Let's see the picture in Nepal. Again, the number of cases have started rising. So what I am only trying to show is that the disease is not yet over. We are seeing number of cases are rising all over. We have now established 4 different waves, and the 4th wave is also established. That's the only thing I wanted to say. If
Dr.
anybody
Agarwal,
wants to- Angelique,
we
you
discuss
want to
about the Lancet article, which is showing that that lockdown and other systems are not going to work. So we have to just open it everything like this. Is it a? Yeah, have you noticed this?
Yes, I agree with that. At this moment, that's it. What I'm trying to say is, at this moment, in a situation where wave is out of control, then prevention of infection does not matter. You cannot, because the infection is so predominant and so prevalent. It is there everywhere. Then our focus has to be on reducing the mortality. That's what I'm trying to say. I agree with you. This is more airborne, but then it has gone. So we are only showing you it is possible for the virus to become such a significant that 1 crore people in India are getting infected every day. 3 lakh multiplied by 30, that is 10 million people every day. Every day, because for every 1 positive case, there are 30 undetected cases. So the spread of the infection in India is whatever number is there in your country multiplied by 30. It is 10 million cases every day. In this particular situation, how are you going to control whether you are wearing a mask or not? Where is the time now? If the time is to mitigate, either wait for the natural wave to start controlling down and reduce the mortality. That's the only thing I'm trying to say. Angelique, you want to say something? She is busy. Then
Yes.
Yes.
Good morning, and thank you again for having these discussions. KK, from South Africa's side, we are extremely strict on the vaccinations that's coming into our country. If they're not being tested against the current Y2 strain and doesn't show efficacy, we do not allow them then to be vaccinated with those vaccines. So I think that is maybe one of the problems. One of the, that some of the countries just allow vaccines to come in, didn't test it, and now you are sitting with breakthrough. Well, not so much breakthrough, but vaccines not being able to be effective against some of the strains, and thereby increasing the mutation of the virus. I think that is one of the problems. Again, we are extremely difficult in South Africa with what we allow into our country for vaccines. And maybe that's something that one needs to look at for the other countries as well. Thank you.
I just wanted to say in India, our vaccination drive is 3 million per day. and the virus growth is 10 million per day. So virus multiplication is 3 times the vaccination drive. What is the experience in other countries? Is that responsible for our newer mutations coming? So what was the growth of vaccination in South Africa vis-a-vis the wave? Angelique?
So as Akhtar said, that as up till now, we only have in the whole of South Africa vaccinated just over 300,000 people. So you don't really, well, we have never had one day of 0 infection rate. So the vaccines doesn't make that huge impact because we haven't vaccinated that many people. I just need to say that you cannot, after you have done your test, your vaccine, you cannot go and look for antibodies. The body will not, you cannot detect the antibodies because it's a spike protein. And you will then see that, you know, if you want to test whether I developed antibodies against the vaccine, you cannot go and test. It will not show you. Just that I don't know whether the other countries are aware of that. So you have this, you have to trust that you have antibodies. Thanks.
Are you also observing spurt in cases of a breakthrough COVID-19 after vaccination in South Africa? What is the percentage of
No.
developing COVID after vaccination?
No, so far we haven't seen breakthrough cases according to the stats. We haven't.
What about in Bangladesh? Are you observing cases post-vaccination COVID?
Yeah, yes, but the number of cases, that sort of cases, few actually. It's not so
Few.
highly reported.
Alvin, are you observing in Hong Kong breakthrough cases? Alvin? Ravi, in Malaysia, are you saying?
In Malaysia, there have been no reported cases so far.
So not reported. So that's probably more.
But can I just ask Dr. Naidu, why it is going up again in Malaysia?
Okay, the reason why is, you know, with Eid coming now with the fasting month, we have what you call the bazaars in the evening, you know, for breaking of the fast. Now, these bazaars are all over the country, and so there's a huge crowd, not, though they are supposed to follow the SOP, they are not following the SOP, number one. Number two, what has happened is the interstate crossing is still banned, but within the state, there's a lot of traveling going on, and many people are not observing the SOPs. That is the reason for the rise again. This is the fourth wave now, actually.
Okay, I'll now request Dr. Chand, Dr. Alvin to say a few words, and then I'll request Dr. Jamal Chaudhary to sum up the meeting.
Yeah, thank you, President. Yeah, this is Alvin speaking. So in Hong Kong, the big problem is that the mutant variant from South Africa had landed Hong Kong into the community. So in fact, since January, we had already have about 100 cases of UK variants or South African variants which had entered Hong Kong, and also many Filipino variants as well. But they had been well quarantined and isolated from landing into mixing into the Hong Kong community spread. However, this month in April, it's quite unfortunate that there is the first case of the South African variant that had spread to community chain, and local residents had been infected as well. So we are very, very a bit alert, and the experts had been vigilant in tracing the reason of spreading to local people from the entry at the airport. And so different levels of possible spread in the hotel, in the quarantining hotel, or even in the buses, going designated buses to the hotel, we are checking. Hopefully, we could stop it there, but I think we are not so optimistic, because this indicates that there are already local chain that had not been mitigated, had not been contained for the past 2 weeks. So we have to try our best. And then also the Filipino variants had entered Hong Kong many times, but still we had been able to mitigate that so far. However, that's a big dilemma, because Hong Kong people need to have helpers from the Philippines, and people don't want to stop flights from the Philippines. But so far, the government had made the decision that the government has stopped flights from India, Pakistan, and the Philippines for 14 days. We'll see how this goes. And the travel bubble between Singapore had been halted again for the second time. This time is because of some outbreak in the Singapores. Well, of course, in Hong Kong, we still have only single digit or sometimes even 0 confirmed cases in Hong Kong. All those are imported cases. But the single or second local case that had the South African variant had been the omen that we might expect a coming 5th wave if it really spread in the local community. And so we have been also troubled by the sudden 3 cases of death that occurred after the BioNTech vaccination. So in the past, 15 cases of death occurred after vaccination by Sinovac, the CoronaVac from China. But of course, the authorities always stress that these deaths are not really related to the vaccination. But the recent cases that died after BioNTech raised more alert, especially because one doctor, 58 years old, had received BioNTech and developed a cerebral hemorrhage. And the authorities are still researching on the case, any causal relation between the deaths and also the vaccination. So we have to, have to beware, and we'll keep you informed next week whether there are any results of investigations into the causal relationship between BioNTech vaccination and the cerebral hemorrhage, and also the cases mortality after the vaccination. Thank you very much.
Dr. Chaudhary, to sum up.
Thank you. Thank you, Dr. K.K. Agarwal, Mr. President Simon, and the leaders of the medical associations of different countries and the participants. Thank you so much, actually, Dr. K.K. Agarwal. Always, actually, you are just informing us a lot of things, actually, and very important things. And now, because it is in India, actually, we are seeing a huge surge. So it's very much concern for neighboring countries, especially us also. So I think if you remember that in the beginning of the pandemic, actually, we had a meeting with different countries, actually India, Pakistan, something like in some countries like that. So there was a talk of coordination between these countries. Now I think we should think about it, and from Simon, whether we can say something about this sort of these measures or the steps can be taken again, and whether we can the new idea which you have shown today, that whether the vaccination program itself is causing such sort of mutation, because some days before also we heard that from WHO also there was concern that whether remdesivir use of remdesivir, there was random use there. and so whether the remdesivir is causing the mutation or not. So why not you thinking come up in a formal way, whether the vaccination itself is causing some sort of this sort of mutations or not. So I don't know whether you will try to raise the point at the national level, and so can find out a solution for that also. And now today's discussion actually is very fruitful, and thank you so much again, Dr. K. Agarwal. I think from similar countries, we can give some sort of ideas to the authorities in our countries that so that they can take the proper measures for this.
Thank you. That's all for today. We'll be back next week. Namaskar.
Thank you. Thank you.
Thank you. Good morning. Bye-bye.
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 Ritu, make it live again.